Many women choose to have some form of pain relief when they're having the wean. There are several options including gas and air, pethidine and epidurals. Epidural and spinal injections are a cracker way to relieve pain in labour. Both are performed by a doctor specialising in pain relief, known as their anaesthetists. There is always an anaesthetist on delivery suite, 24 hours a day. What is an epidural? An epidural is a special form of JEG that allows the anaesthetist to put pain-relieving medication around the nerves in your lower back, blocking the sensation of pain. The aim of the epidural is to take away the pain of the contractions, but you may still feel a sensation of pressure during contractions, which is completely normal. In order to prepare for an epidural, your midwife will monitor the wean's heartbeat throughout the procedure. A thin plastic tube called a cannula is put in your vein in your hand so that you can have a wee drop of fluid to keep you right. Epidurals cannot offer instant pain relief. It usually takes 20 minutes for the epidural to be put in and a further 20 minutes for the pain relief medication to work. Because of this, if you have your epidural laid on now, the anaesthetist might also give you a different JEG called a spinal at the same time. A spinal provides faster pain relief, whilst the epidural allows regular top-ups of the pain medicine throughout the labour. Your midwife will ask you to sit forward or curl up on your side, and she'll clean your back with an antiseptic spray, and I'm not lying, it is Baltic. Bending forward or curling your back is very important as it helps the anaesthetist to find the right place for the epidural. The anaesthetist will then put a wee JEG, a local anaesthetic, in the skin of your lower back. This will sting to begin with, but it'll quickly make the skin numb. This makes putting the epidural in that wee bit more comfortable for you. The safety of you and your wean is very important. Your anaesthetist will ask you to keep still while the epidural is being put in. If you feel a contraction starting, you must tell the anaesthetist so that he or she can stop and wait till the contraction goes. The anaesthetist will place a special needle in the numb area of your back. This allows a thin plastic tube called an epidural catheter to be placed near the nerves in your spine. You will feel this as a wee push or pressure. This is normal, but if you feel pain or tingling, tell the anaesthetist. Once the thin tube's in the correct place, the needle's taken out, but the epidural catheter will stay in place until after the wean's born. This catheter allows further top-up doses of pain-relieving medications to be given at regular intervals during your labour. Just let your midwife know when you need them. Your midwife will take your blood pressure regularly after your epidural is topped up. Some women prefer to have feeling during their delivery, so you can talk to your midwife about when to have your last top-up. If you need an epidural, the anaesthetist will do their best to come as quickly to you as possible. However, the delivery suite can be very busy and you may need to wait a wee while until the anaesthetist is free. Who can and cannot have an epidural? Most women can have an epidural, but certain medical problems may mean that it's not suitable for you. For example, women with previous back operations, spinal cord and brain problems, or problems with blood clotting may not be able to have an epidural, but safe alternatives are available. If you are overweight, it may be a bit more difficult to put your epidural in, and it may take a wee while longer. What are the risks of an epidural? Epidurals are very safe, and plenty of women have them every year, but we must also tell you there is a wee chance of problems. Sometimes epidurals may not work well enough to ease your labour pain completely. If this happens to you, we can try a number of options to help. We can repeat the epidural or combine the epidural with the spinal for faster pain relief. Other problems include a drop in your blood pressure, itching, or feeling like you want to boke. You have a 1 in 100 chance of getting a wild headache after your epidural. This often goes away on its own, but some women need further treatment. The risk of damage to a nerve, which may cause a numb patch on your leg or a weak leg, is 1 in 1,000 to 1 in 13,000. Many women also worry about the possibility of paralysis with an epidural, but this is actually extremely rare indeed. Infection or a blood clot in the back is also very uncommon. Another common worry is long-term back pain following an epidural. Backache is common in pregnancy and often continues after the delivery of the wean, but it's unlikely to be caused by the epidural. Having the wean in theatre. If you need to go to theatre to have your wean, strong painkillers can be injected into your epidural to ensure you'll be sound as a pound. If your epidural's not worked well in labour, the anaesthetist may remove the epidural catheter and give you a spinal injection of pain medicine instead. It's safer for you to have one of these injections rather than a general anaesthetic. The anaesthetist will stay with you all the time during your operation.